Hi, my name is Dr. Mark Rosenberg. My research with regards to medicine carries me in many different avenues. My passion, since my mom died of lung cancer 6 years ago, my passion has become researching cancer, because certainly the treatment of advanced stage cancer in this country has been less than successful. But I do study the great difficulties we're having in medicine well beyond cancer. Obesity, as everybody knows, is a big problem, and I developed a drug for obesity, and I started my own pharmaceutical company. Other big problems we have, of course, in this country are the neurodegenerative diseases like Alzheimer's and Parkinson's. And one of my areas of focus is looking at hyperbaric oxygen therapy and seeing how that can help the neurodegenerative diseases. And certainly we're seeing some benefit. We don't use hyperbaric oxygen nearly as much in this country as they do in the Eastern Bloc countries. Certainly it's big in Germany, it's big in Russia. And when you read their literature, it's very exciting, and hopefully someday other physicians will use it more routinely. Hyperbaric oxygen therapy can help everybody. As some of you out there may have heard that a lot of the professional athletes use hyperbaric oxygen. What hyperbaric oxygen is it's 100% oxygen delivered at higher atmospheric pressure. So if we're at 1 atmosphere or sea level, typically a portable chamber will give you 1.3 atmosphere. And that allows oxygen to diffuse throughout your body. It perfuses your organs better, your brain, and all your muscles. And certainly the professional athletes like it because you feel good when you're oxygenated, and certainly your muscles can do better when they're higher with oxygen. With respect to the diseases, neurodegenerative diseases such as Alzheimer's and Parkinson's, there's usually a component in which there's not adequate blood supply or oxygenation to the brain. Even though that's not the cause of Alzheimer's or Parkinson's, it's a component. So when most patients with these neurodegenerative diseases are exposed repeatedly to hyperbaric oxygen, they perfuse their brain with oxygen better, and we often see great improvements in cognitive ability and mood. Are the improvements temporary or are they permanent? That is a question that hasn't been answered, certainly with the United States literature, because we haven't funded adequate studies. We certainly can see that with repeated use, the benefit stays. The question is, if you used it, we'll say, for 3 months and you got benefits and then you stopped it for a year, would you go back to where you were? There is no study to answer that now. But certainly, since there's no downside to continuing the use of hyperbaric oxygen therapy, I recommend patients with neurodegenerative diseases to continue it. At SMAC, we have a portable chamber. Now, the advantage of a portable chamber is you can do no harm. And what I mean by that is if you get the atmospheric pressure too high, you can get what's called oxygen toxicity, which can even cause seizures. With a portable chamber, because you cannot exceed 1.3 atmospheres of pressure, you cannot get oxygen toxicity. So we're one of the few places that have the portable chambers. Hyperbaric oxygen really can be used for many, many purposes. Not only is it good for neurodegenerative diseases, it's good for the athletes, but it's good for someone who's just trying to slow the aging process, what we call anti-aging medicine. Because as we age, we perfuse poorly with blood areas that used to get plenty of blood. That means less oxygen to areas that used to get more oxygen. We know with hyperbaric oxygen, it not only increases the blood supply, but it also increases collagen production in your skin. So certainly for the average person who just wants to slow the aging process, I recommend hyperbaric oxygen. Now, hyperbaric oxygen is also used in this facility for the cancer patients. It's an area that is controversial, but the latest literature is showing us that a well-oxygenated tumor is a happy tumor. And what we mean by that is if a tumor is really poorly oxygenated, it tends to spread. It tends to metastasize because it's looking for better blood supply. So the data shows that the less oxygenated a tumor is, the more aggressive it is. On the other hand, the better oxygenated it is, the more likely it is to stay there. So I actually have my cancer patients also getting hyperbaric oxygen therapy, not to induce remission, but to help stabilize.